Hello everyone, now let us discuss about 2023 coding guidelines for cardiography. This comes under medicine chapter of CPT under the subdivision cardiovascular. So coming to the codes 93040 and 93042 are appropriate when an order for the test is triggered by an event. The rhythm strip is used to help diagnose the presence or absence of an arrhythmia and a report is generated. There must be a specific order for an electrocardiogram or rhythm strip followed by separate signed, written and retrievable report. It is not appropriate to use these codes for reviewing the telemetry monitor strips taken from a monitoring system. This is important. It is not appropriate to use these codes for reviewing the telemetry monitor strips taken from a monitoring system. And the need for an electrocardiogram or rhythm strip should be supported by documentation in the patient record. These are some of the guidelines. And for echocardiography, now we are discussing about cardiography. For echocardiography, we need to see the codes 933032 to 93350. And for acoustic cardiography services, we need to refer 93799. Now coming to the CPTs, there are a list of CPTs for complete interpretation and report, for without interpretation and report, and for interpretation and report only. The first CPT is 93000. Electrocardiogram, routine ECG with at least 12 leads with interpretation and report. This is a complete procedure which can be done by cardiologist. The next is 93005. Here tracing is only done. Tracing only without interpretation and report. The next is 93010. Interpretation and report only. And for ECG monitoring, we need to see 99418. These are prolonged care service codes that we have discussed earlier. For ECG monitoring. And do not report 93000, 93005 and 93010 in conjunction with 05250, 05260, 05270, 05280, 290, 30, 31 and 32. Next CPT is 93015. This is cardiovascular stress test. Whenever cardiovascular stress test is performed, you need to report 93015. This is also divided into a couple of codes. 93016 is given for supervision only without interpretation and report. 93017 is given for tracing only without interpretation and report. And 93018 is given for interpretation and report only. So coming to 93015, it is cardiovascular stress test using maximal or submaximal treadmill or bicycle exercise, continuous electrocardiographic monitoring and or pharmacological stress with supervision, interpretation and report. When all three are done, you need to report 93015. When only supervision is done without interpretation and report, you need to report 93016. When only tracing is done without interpretation and report, you need to report 93017. And when only interpretation and report is done, you need to report 93018. Next CPT is 93024. Ergonovine provocation test. This is used to report ergonovine provocation test. The next is 93025. Microvolt T wave alternance for assessment of ventricular arrhythmias. This is done for the assessment of ventricular arrhythmias. Microvolt T wave alternance. Next is 93040. Rhythm ECG 1 to 3 leads with interpretation and report. Previously it was at least 12 leads. Now it is rhythm ECG 93040. Whenever rhythm ECG at least 1 to 3 leads is done with interpretation and report, you need to report 93040. When only tracing is done for rhythm ECG 1 to 3 leads without interpretation and report, you need to report 93041. And when only interpretation and report is done for rhythm ECG 1 to 3 leads, you need to report 93042. Next CPT is 93050. arterial pressure waveforms analysis for the assessment of central arterial pressures, including obtaining waveforms, digitalization and application of nonlinear mathematical transformations to determine central arterial pressures and augmentation index with interpretation and report, upper extremity non-invasive. This is done for assessing arterial pressure waveform analysis for the assessment of central arterial pressures. And one important note is, do not report 93050 in conjunction with diagnostic or interventional intra-arterial procedures. You should not report this in conjunction with diagnostic or interventional intra-arterial procedures. Now let us see examples. A new patient is having a cardiovascular stress test. Here the patient is having cardiovascular stress test done in his cardiologist office. Before the test is started, the physician documents a comprehensive history and exam and a moderate complexity MDM. And the physician will be supervising and interpreting the stress on the patient's heart during the test. So interpretation and report is also there here. What procedure code should be done for this encounter? First, the patient is coming for a E&M service, outpatient E&M service, and he is a new patient. So first 99204, that is office or outpatient visit for evaluation and management of a new patient. And here the MDM level is moderate complexity medical decision making, which requires medically appropriate history and examination and moderate MDM. Since he is reporting moderate MDM, we are coding 99204. And additionally, cardiovascular stress test is performed. So you need to append 25 modifier in order to indicate separate identifiable procedure done on the same day. 25 modifier to indicate cardiovascular stress test is also done. And the physician is interpreting and supervising. So supervision, interpretation and report is also given. So the appropriate CPT is 93015. 93015, cardiovascular stress test using maximal or submaximal treadmill or bicycle exercise, continuous electrocardiographic monitoring and or pharmacological stress with the supervision, interpretation and report. So this is the appropriate CPT for this example. Let us discuss the second example. Cardiologist performs 12-lead ECG and he interpreted it on patient with a 60 years of age. So interpretation is done for 12-lead ECG. And the cardiologist is performing with interpretation and report a 12-lead ECG. The appropriate CPT is 93000. Electrocardiogram routine ECG with at least 12 leads with interpretation and report. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.